आपको थोड़ा सा डिफरेंट लगा होगा इसका टाइटल, दिस इज़ बेसिकली वर्क फ्लो नॉट CME. देयर इज़ अ लिटिल बिट डिफरेंस टू चूज़ फॉर दिस वन वर्क फ्लो. ये मैंने सिर्फ इसलिए किया कि फॉर द फ्यूचर एक्रीडेशन वी नीड अ प्रॉपर SOPs एंड वर्क फ्लोज टू मैंशन दैट वी आर बिलोंग्स टू अ रिनाउंड हॉस्पिटल, और हमारे हर चीज़ के SOPs और वर्क फ्लोज हैं. नंबर 1. दूसरी बात इम्पॉर्टेंट ये है कि फॉर बीइंग ए वेरी सेंसिटिव रीजन ऑफ द वर्ल्ड, वी आर नाउ heading towards the breast cancer in the number 1 position, and the other CS cervix like that, to aware the community how dangerously we are heading towards the breast cancer. So what is the workflow basically? Workflow is that SOPs and that which is mandatory for any hospital for the smooth working, for the hospital, for the patient safety, and to consider them in a safe zone. So now we started. This is a type of a leaflet and a workflow for the self examination of the outpatient department. So basically this workflow belongs to Buch International Hospital. This is prepared by me and it will be reviewed by our medical officer. So this what I said, that this workflow is belongs to Buch International Hospital. The title is self examination of the breast in an outpatient department. The purpose of this workflow is that the purpose of this workflow is to raise awareness within the community by equipping qualified health providers. What are qualified health providers? All the people who are sitting inside the room, all the people who are helping us, all the people who are part of this Buch International Hospital. The purpose is for them, qualified health providers with the knowledge to effectively teach women the importance of breast self-examination. We have the potential to save not just one life but an entire family. What is introduction? Performing regular breast examination is proactive way to monitor changes in breast tissue and detect potential abnormalities. It involves visually inspecting and self-feeling of breast for any lumps, changes in size or shape, or any other unusual signs. Additionally, regular mammograms and clinical breast examination by a healthcare provider. ये introduction ये था कि feeling of breast and lumps changes in the size or shape or any other unusual signs. Additionally, regular mammograms and clinical breast examination by a healthcare provider are crucial for comprehensive health care, breast health. Clinical significance. Clinical significance. Patient safety and health is our number 1 priority. This workflow serves to ensure women are directed along a standard pathway for the point of decision making to discharge from the facility for their health problems. What is the scope of this workflow? This workflow applies to healthcare professionals trained and authorized to teach how to do self-examination of breast in our OPDs, not gynae and obstetrics, because it's go for the even surgeon, and even the patient came and they can ask for their breast examination for even our paramedical staff, even for the healthcare provider. The healthcare provider responsible for teaching self-examination of breast. Sports staff is always mandatory, which is manage communication, documentation and appointments. Procedure. Breast self-examination. Number 1, visual inspection. There are different methods. First, I will go for just theory, and then I will present some pictorial messages. Stand in front of a mirror. You have to teach to all the community, especially the female, that there are the different ways for self-examination. Stand in front of a mirror with your arms at your side. Look for changes in size, shape or contour, as these are very important. Check for any skin changes such as redness, dimpling or puckering. Raise your arm. This is the first one, with your arms on your side, and the other is The other inspection is raise your arms overhead and observe for any changes as described above. The second one, examine breast in different positions. While lying down, use your right hand to feel your left breast and use your left hand to feel your right breast. Use the pad of your 3 middle fingers in a circular motion to cover the entire breast. Apply light, medium and firm pressure to feel different depths of tissue. Feel your breast in 2 positions. First with your arms at your side and secondly with your arms elevated above your head. Include the armpits area on each side. Do not forget to inspect this one. Your armpits are very important because we have some axillary tail, 70% of the women have axillary tail which they got that it is some abnormal, but usually it is not an abnormality, it is just like a pad of fat. Look for changes in nipple position or any abnormal skin changes. Gently squeeze each nipple to check for discharge. Remember, report any change or abnormalities to your healthcare provider promptly. This is the take home message कि आप अपने पेशेंट को जब आप ये वर्क फ्लो बताएंगे और उसको फॉलो करेंगे तो उसको ये ज़रूर कह के भेजना है कि सर्टन डेज, वो मैं आपको आगे जाके बताऊंगी, आई विल टेल यू व्हाट विच डेज आर इम्पॉर्टेंट इन आवर मेंस्ट्रुअल डेज, जिसमें शी हैज़ टू गो फॉर दिस एग्जामिनेशन, बट एनी चेंज शी फेल्ट शी शुड रिपोर्ट टू योर हेल्थ केयर प्रोवाइडर प्रॉम्प्टली. परफॉर्म द एग्जामिनेशन रेगुलरली, ideally once every month after a menstrual period, and be aware what is normal for your breast. Why to avoid in menstrual health? Because in menstrual cycle there are certain hormone changes, so we go and we do avoid from this. इसको थोड़ा सा नीचे करें. This one, perform the examination regularly, ideally once every month after a menstrual period, and be aware what is normal for your breast. Training and competency, as I prepared this CME in the form of workflow, which would be the part of Buch International Hospital. So, this is for the official method, this internal audits. जब हम कोई workflow बनाते हैं तो we have some internal audits to check the competency and for implementation of the SOPs. Next, specialist doctors conducting the above SOP must have been supervised and formally signed off for independent practice. This is all what the international implementation of workflows in such manner. Training, debrief after every operating list to enhance patient experience and optimize patient safely. This is one of the feedback process. Next, थोड़ा सा ऊपर करें से. Next, now this is one of the pictorial images for the breast examination. Actually we have the custom कि हम कुछ लिखे हुए words भूल जाते हैं लेकिन pictures हमारे उस पर impact रहती हैं. So, what is breast self examination? Breast self examination is a common screening method which is done by the patient herself as an effort to flag by the presence of breast cancer and its earlier stages, physically examining both the breast for the possibility of any lumps, distortions and swelling. Next, what is the purpose? Yes, this is the way of the pictorial how you will examine. It is look in front of the mirror. Number 2, first on the side of the arms, then above the arm. This is only the inspection in which you can see when you inspect in this position the breast abnormality, they can reflect by their self, like the lumps they appear, like the puckering, and even the change of the position they can appear in this way. Next, breast self examination should be like that. This is one, we can make a leaflet for the help of the patients in our OPDs. This is for the calendar. This is once in a month, usually 7 to 10 days of their menstrual cycle. This is what the examined breast. Don't forget to check the armpit. This shaded area is the armpit. These are the pads of the fingers which we use for the only the 3 fingers. By in the first up and down position you have to palpate, then in the wedge position and in the circular form. Next, yeah, this is the last 3 pictures shows when you raise your arms above the above your sides, what the abnormality that reflects in that way. These are the lumps. This one is the change in the position, and gently if you gently squeeze that nipple, any change, whether it's in the form of milk or some secretion, they can squeeze by this form. This is the change in, even you have to notify the skin color. When you raise the arms, the whole position of the breast, they will appear by itself. Scroll up it, next one. Yeah, this is again a pictorial message. I have got this different references from our in the South Asia and some the European hospitals. They have their leaflets in such forms, and they are printed on their hospitals and in their OPD departments. This is important. Their calendar, you have to mention the calendar. This is very important. Don't ask them to check their breast in the menstrual days, because it may sometimes they are not so much good assimilation. Number one, stand. This is again the standing position. There the position. Next, a little bit. Yeah. This is the last. What would be inside? Examine breast and armpit with raised arms. Use finger pad the massage. You can use the massage oil. If you feel dry in your fingers, then you can take the massage oil or the shower gel. Now you have to feel. This is second one is the wedge. This is not clear because of the so much lights, but the first one is just up and down with the hands. This second one, you make a wedge to support your breast and palpate like this, and the third method is in the circular form to make whole the quadrants, just not to miss any area. Next, this is how we summarize the end of the workflow. How do I do a self examination? This should be a leaflet, and this is a manual breast self examination while standing. Use your right hand. Again I emphasize, tell them use your right hand to your left breast. For your left, use your right hand, feel for any lump, thick spots and other changes. A circular pattern may help you make sure you hit every spot. Next, a little bit upward. This is the second picture is again the pictorial images for the raised arms, and with the 3 fingers, this one, this should be strict in your mind, and you have to tell to your patients. And again, don't miss the nipple, check its position, any change, areolar region is very important. And a gentle squeeze. Now, the most important thing is 3-1. If you said, if people ask you whether what about the lactation mother, go for the lactation or not. What about the menopausal? What about the perimenopausal? And what about their young ages? You have to tell lactation mother, the best time for the lactation mother is to examine when the milk is not there. When she should empty her breast and then examine, and it should be once in a month. Don't forget कि lactation में कुछ नहीं होता, no, but any abnormality can pick by after emptying the breast. Number 2, menopausal. How can we can say that menopausal cannot get this? No, but some of the rare cancers, they appear in the menopausal age. So ask them, they can choose one in a month. Though they are not related to their menstrual cycle, but they should only once in a month is enough. They should mark it in the calendar. And the first, the reproductive age, I already told, better for the within the 7 to 10 days of the menstrual cycle. So by applying these leaflets, by following this workflow, which is for the safety of the patient, I think these workflows are very mandatory for any hospital, for their accreditation to the for their international level, for their national level, and for the safety of the patients. Thank you very much. Any question?